So hi, everybody. So we, in light of everything that's happening, we kind of wanted to get together and have one of our conversations on camera and post it so that everybody can kind of see what we typically talk about just on an everyday basis, and how race and our diversity as friends kind of impacts us as SLPs and our time in grad school. We are all recently graduated from our master's programs and we're in our first year of working. So I feel like we kind of have a unique perspective on what this all means and how it impacts our field. So we feel like this is a perspective we want to share with you guys, and hopefully you find it useful in some way. So as we all know, speech pathology is a white-dominated field. So we have only 8% of SLPs identifying as non-white and only 4% identifying as Black. So definitely us as a group of Black SLPs, we feel like, you know, we have something to share and we have a unique perspective. So we actually put a poll of SLPs out on Instagram, and 75% of the SLPs who responded were white, but they all wanted to know how they can do better and learn more about how to best serve their diverse caseloads. So hopefully we can shed some light on our experiences in grad school and in the workplace. And we're also going to have some other guests come on that can share their experiences and how it's impacted them. We have some of our professors, our clinical instructor, and then we also have our friend Katie Davis, who is going to talk more about her experience as well. And we just wanted to thank Abby at the Type B SLP and Meredith at the Informed SLP for putting the question box out there and stepping up and helping us gather all the great questions that you guys submitted. So to start off, I just wanted everybody to kind of go around and introduce themselves. We're going to say our names, our ethnicities or cultural backgrounds, what cities we're from, and then kind of where we've been working. So I'll start off. My name is Hanifa Cummings. I am Black. My family's from Belize, so we're Latin American. I am from Chicago, and I worked in a private practice with children with autism. So I'm going to direct it over to Vanessa.
Okay. Hi, I'm Vanessa Hill. I am a Black woman, obviously. My ethnicity, my mom was born in Ethiopia, and her mom was Ethiopian and her dad was Greek. And my dad is a Black African-American man, so I'm a little bit of mixed in everything. I grew up in ATL. I am currently living in California, working in the school system. So that is my current workspace.
Great. Whit?
My name is Whitley Tucker. I am from El Paso, Texas. I am Black and Mexican. So my dad is from Chihuahua, Mexico, and my mom is Black. She's from El Paso. And I currently serve the adult TBI population in a post-acute rehab setting.
Great. And then Shay?
For me, I am Victoria Davis, or Shay, and I'm from Charlotte, North Carolina, and I'm Black. I identify as African American. I work full-time at a middle school, and I do PRN work at a hospital in inpatient rehab.
Great. So just to remind you guys, we are all friends, and so this is going to be a casual kind of conversation. It's not going to be stiff. It might not be super, you know, and we also all refer to each other by nickname. So, so we might not do full names every time. So the first topic we wanted to discuss is diversity and race within the academic setting or within grad program setting, since that's where we kind of have the most experience. And so that's the topic we can probably speak on the most. We asked the SLPs on Instagram how diverse their master's program were, and I just wanted to read a few of those responses. So
I just want to make sure we're in gallery view, right?
Yes,
Mm-hmm. Yes.
I think so, yeah. So most of them said, so some of them said it was not very diverse. My cohort had one student of color. They said minimally diverse or majority white. I was one of 2 Latinas. It was, it says, in terms of grad students, mostly white. Not at all, not much, not very diverse. only 3 students of color. So we definitely feel like we have a unique experience because our grad program, not only did we have a good amount of people of color in our cohort, but we also had diverse faculty as well. So we wanted to talk about our experiences in grad school and, oh, wait, go ahead.
So to open up general discussion, we wanted to first address what our experiences were like in grad school and why we feel our program was unique. So the location of our university was in an urban setting in Atlanta, Georgia, in the smack dab in the middle of downtown Atlanta, Georgia. So that gives you kind of an idea of what the population was like. It was a mix of pretty much everything, I'd say, in terms of diversity.
Yeah.
And then the staff was also diverse as well. There were people from all different backgrounds. They spoke all different languages. They brought different experiences to the table in terms of where they've lived in the US or outside of the US. So it was a lot of cultural perspective that we gained through our program and meeting people within our program and even outside of our program as well.
Right.
And I will say, like, as far as our staff, we had the very, I would say, privileged opportunity to have a lot of Black staff at our school. And looking back on it now, I also want to highlight the importance that the Black staff in our school who taught us were not okay with the current status quo, and they pushed the lines. They were not quiet. They really spoke to us and were a support system for us whenever we needed it. And that I appreciate, because it could have been a situation where we did have a diverse staff, but they were okay with the status quo and did not provide that support. So I really think that's an amazing thing that they did.
Right.
They were very
that. Sorry.
Go ahead.
Beyond that, but just for those of us who watched the SLP town hall, the professor who spoke about being a gatekeeper, I feel like our diverse faculty really took that responsibility on and make sure they attracted more minorities to our program and gave us the opportunity. So I really valued that as well.
Yep. And we also had very diverse clinical placements. One of the benefits of being in the location we were is that we served all sorts of populations. And not only did that give us an advantage in terms of our cultural competence, but also I feel like afterwards looking for jobs, we really were able to explain the breadth of people that we got to serve. And I think that has definitely been a big plus at least in my job search. It's definitely been great. So let's move on to our second question.
So one of the first questions that we came across sent in via Instagram was, why aren't grad programs and the field in general diverse?
That's a big question.
Anyone want to take that?
I can start on that one.
Okay, go ahead.
One, I feel like specific to us, speech language pathology grad program is not diverse but one of the reasons is because just awareness of the field. I still realize people do not know what we do, who we are. They're like, what is that? And I'm like, just simple awareness of knowing what the field is. And then once you're aware, then you take the step to actually join. And then that's where another barrier of color is going to be put onto you, because now it's like you have GRE scores, you have these standardized tests, you have these things in high school that may have caused you to not maybe have a higher GPA, or even if you do have a higher GPA, they're looking at something else. Like, it's just all these different moving parts that we need to address, which is why I also, once again, respect the school I went to because of the different things they put in place, like allowing us to apply on CCC-SLP, which is more of a domestic, really whole picture graduate application program. Things like that they did to help increase the diversity of the cohort.
Right. Yeah. One of the things they talked about on the town hall was also, once you get into grad school, which is already a hurdle, there's this hidden curriculum within higher education, which is you need to know how to navigate the politics of higher education. And that's something that that might stop a lot of people of color from either getting in or succeeding once they're in, not because they are any less smart or they're any less capable, but it's because they have to learn how to navigate, supervisors and setting up meetings and asking questions without being labeled as, difficult, and all these different things that, sometimes more pressure is on women, people of color, women of color, and that might be also a barrier of entry as well.
I also think representation goes a really long way. Like Vanessa said, so many people still don't know what a SLP is when I tell them what I do. And I think considering we all, or many of us went to public schools that had an SLP, it's really no reason that so many people should not know what a speech pathologist is. So many of us were in the same buildings as them for 12, 13 years.
Right.
So I think, especially as minority SLPs, we need to be more visible and vocal about our positions and what we do. And personally, that's why I'm really adamant about not being labeled a speech teacher, because I feel like it's important in a Title I school where I'm surrounded by minority students that they see someone who's not a teacher, that they see this professional and they're saying, oh, that's the speech language pathologist. What is that? What do they do? I think that's very important to see.
Right.
And another important point, just in general about the lack of diversity in grad programs is access to funding, access to resources. During one of our casual discussions, as we always do, I brought up the point about you don't have to necessarily be a charity case in order to receive funding or access to these grad programs. You don't have to, in your personal statement, talk about all the times that you struggled or even make up things that you struggled with, You can be a normal Black woman or man who is just looking to pursue the field of speech language pathology.
Right. So we do have another question, but we need to have on one of our guests right now, so we might have to address that later. So if you want to go ahead, V.
Okay, so I'm going to introduce our next guest, who I love so much. Okay,
we're so excited.
So our next guest is Angela Miles, and she is one of our clinical instructors. So she was the clinical instructor to all of us. Not every student, but most of us had her as a clinical instructor at one point in our grad, career. And she also taught fundamentals in our original, our first semester.
Our first year.
And then she is also competent in the Georgia Leadership in Education and Neurodevelopmental Disabilities program. So I want to welcome on Mama Miles.
Hi.
Love her so much.
Hi.
So nice to see all of you all.
I know, you too. You're glowing.
I wanted to let everyone know, this is just off the cuff. She was, to me, one of the toughest clinical instructors, and that is what I appreciate about her the most. She was not easy on any of us, and that is why I learned the most from her, because she was difficult. Because I got read every time.
Challenging.
That is what I want, and so welcome, Ms. Miles, sorry.
Thank you.
Okay, so thank you for joining us, Ms. Miles. We are going to start off with one question we actually didn't send you, but we're going to lead you to have 1 minute to answer this question. We just talked about how diverse and how lucky we are to have a diverse staff, and to actually have about 6 or 7 of us in the program that were Black. How do you feel like, in comparison to our grad program, how diverse your grad program was?
Well, in my program, I was the only Black student. So there's that. And I was in Southern California, and it was actually during a time where there was still, similar to today's mantra, there were a lot of protests going on. And so I was kind of like, are you the voice of the people? There's a lot of expectation for me to represent a bigger population from which I came.
That's a lot of pressure.
That is.
It was. It was a lot of pressure. Huh?
Did you feel like you experienced microaggressions or blatant racism or prejudice during your grad program?
Oh, yeah. It was blatant and micro. So I got questions like, in your community, do you think rap would be a good option for those who stutter? You know, as an option to help them speak. It's like, huh? I mean, no one raps. I don't rap. I want to be able to rap, but then, you know, so I actually came to the discipline from a different discipline. So I had like a lot of ramping up to do in communication sciences and disorders. And quite frankly, I was not a strong student at the time. And so there was a lot of pressure just to perform academically. And in those spaces, there were comments like, are you sure this is for you? You know, maybe you should rethink your profession. I would get a quiz and the professor literally would say, this can make or break it for you, so do your best. You know, so it was a lot of pressure and stress.
Yeah.
Ooh. For sharing that, Ms. Miles. Okay, so the first question we actually have for her came from you all out there. So we wanted to ask, how can a graduate program, structure itself to best serve and ensure the success of their diverse students?
So I think that the first step is really just to identify what you mean by diverse students. I think on the front end, especially in CSD, ComDis, you think of a male or female, or you think of minority groups or race. And really diversity, it can be age, it can be sexual orientation, religion, political ideologies. There's a lot of things that go into diversity. And then within that, each one of those different types or characteristics bring different perspectives. And so then you really need to think from a program standpoint, how do we educate diversity in its bigger sense? And how do we create space for all of those differences so that they learn, feel supported, and there's equity, and then they're also prepared to work with that much more diversity out there on top of a communication disorder. So I've been in the academy for over 20 years. Don't let these high cheekbones. But I would say that whole thought process has been an evolution. I didn't come to the academy thinking that. I think I was very narrow-minded in like, oh yes, we need more men. Oh yes, we need more Blacks, Asians, Hispanics. But in that space, I know for our program in particular, we had to acknowledge that, yeah, we look real diverse on the surface, but that our approach wasn't very diverse. And so we had to take a step back. And as a faculty, I initiated this look of, let's look at ourselves, you know, my favorite. Take a look, because one of the things you have to think about is humble leadership. You can't just go in there bulldozing saying this ain't right, and you know, you really have to think about what is the audience and what is their capacity to understand. And so we had to acknowledge the problem. So it started with conversations that were off the record, just to see, am I seeing what you're seeing, or is, you know, what's going on from the student perspective? And then bringing those back to the faculty and initiating. We read The Blind Spot by, I think it's Pathology and I can't think of it, Greenwald. And that book really helped identify that everyone has a blind spot. And it was a gentle nudge into like, you seeing this thing twisted. And that helped us create space to now have bigger conversations.
Which leads us to our next question.
Yes.
How did you provide, or how do you provide a safe space for your students of color?
I think the first thing that comes to mind is to actively listen. I try to show up as who I intend to be. I try to model excellence, even though it's very hard. Sometimes I think I'm very hard on myself, but I try to model a certain way to carry yourselves as Black clinicians. And so I try to show up that way. I try to be transparent. You know, when it's hard, it's hard. You know, when I think you can do it, I'm gonna say it. You can do it. When I think you need some help, I'm gonna say you need some help. You know? So I try to also be transparent and honest, and then also trustworthy. I think it's that's something that I realized is really important in teaching, that you have to create a space where the student can trust you so that they will take these risks. Because it's a risk to learn and believe that you're not going to fall, and that even if you do fall, you'll get back up and keep going. You might repeat the course. That's a possibility, but you might not. Let's go. You know, and I think that's important. And also to listen, to find out, like, what are the real issues and concerns? Is it just fear? Is it lack of preparation? Is it just, you know, is it something totally unrelated to academics? And then the last thing I always think about when I think about diverse students or students of color is strategize. I will have a student in my office be like, look at here, you need to find the girl who's getting the A in this class and study with her and sit down and keep going. You ain't got to be best friends, you know, and make sure that you sit in the front of the class, ask the questions, and kind of position themselves to be received as a, you know, a competent learner.
Awesome.
And I think, Miss Miles, for a lot of us, you were that safe space. I know I've cried in front of you. I know a few of us have cried in front of you. But I think that's what you need. You need to be there for your students, and you need to let students know that, you know, they can come to you as they are, and we can work from that point. You know what I mean? So.
And it's interesting that you say that, because in that space, I've also had to learn that not everyone who looks like me wants to be supported by me. And that's been hard to receive, because in my program, like I said, I was the only one, and I would have prayed for Miss Miles, who could see through my, like, I'm fine, to like, girl, you know, come in here and sit down and get this information. You know, and there are some students who don't want that for whatever reason. And I've had to learn to respect that. And it's always like, oh, okay, that's fine. I hope you make it.
Okay. The next question I feel like is my favorite, but it is, how do you educate white students on how to become more culturally competent as speech pathologists that will likely be working with diverse clients? Once again, diverse being more than just people of color now when we think of that word before we put it in here, but just like, we'll keep it more towards students of color when they go into the field.
Yeah. So I think that I start with compassion and encouragement, and encouraging them to be self-aware and self-reflective. It is easy to take the position of, what you're going to learn today about my people is, but there's no partnership in that space. And I think it's important to just like I create a safe space for students of color, I have to create a safe space for students who are majority. And so this revelation, this is also an evolution of thought. So when I participated in a leadership conference at one point, or a leadership, what is that, a fellowship? And it was basically for individuals who had disabilities. And in that space, I realized that I was nervous about offending somebody. And it was interesting because as a speech pathologist, I work with people with disabilities all the time, but I don't have many friends who have visible disabilities. And so there were just little nuances, like, do I offer to help? Do I not offer to help? Do I say this? Can I not say this? Is this the right term? You know, all of these different things, but my intentions were good. And so when I now go back to the perspective of students who are not of students of color, I think about the fact that they came to this profession I start with the thought that they have good intentions. And then from there, I try to shape those intentions, whether it be through guided, like self-awareness. So you all know that I like to say, let's look at our temperament. Let's see who you are, who's showing up, because that's where you're starting from. And when you're nervous and you have diversity in front of you or something new in front of you, you're going to default to whoever you really are. And so let's have those hard talks. And then let me give you some tips. Like, we're not going to have a regimented schedule for this child and punish him because, you know, and giving some information in those spaces about why, which oftentimes is just a blind spot for them. Like, oh, I never thought about the fact that this child may be singled out all day, and now this is me doing it again for an hour in a 2x2 room. And then I also finish with self-reflection. So I try to ask the students again, think about who you are, think about who your client is, and how you all how you all came to the same space, and how you can adjust next time. And so it doesn't really have a big conversation about like race and color, but I think when you really think about what works, it's really finding the space where both agree. And I think we have to teach, how do you get to that space? How do you get to a space where you can experience difference and appreciate it, and then also respond in a way that facilitates whoever you are working with? And that's likely going to be someone different.
Agreed. And I like the point where you say like really being self-aware, because I feel like that's a component that has to be put at the forefront. If you're not aware of what you're doing or aware of what you're saying, you have to be willing to become aware of it if you want to move forward. And sometimes when someone calls you out on something, you may take it offensively, but you have to step back and say, okay, you really have to take that step back, or else you'll get offended, close the book, and move on, because you don't want to be offended anymore. So I think that's a very important fact.
And that's a hard thing to do, especially
is.
when you're learning. I'm taking some college courses right now, and I had to call the professor, and let me tell you, I was doubled over humble, like, oh, gracious one, but it took a while for me to even call, because I was like, I could figure this out. But yeah, so that's also where the compassion comes in as a professor, to recognize that this student is trying to navigate a whole lot of humble pie while they're learning, and then they have this added thing of like, I don't even know anything about this.
Yeah.
Thank you so much, Miss Miles.
Thank you,
Yes,
Miss
thank
Miles.
Call. We
We
really
miss you.
We do.
It's so good to see all of you all. Stay in touch.
Thank
We
you.
will.
Okay, now how do I get off?
There should be a leave meeting option.
Oh, there it goes. Bye.
Bye. And Dr. Johnson is waiting, so I will admit her. Hi. You're muted, Dr. Johnson.
Oh my goodness.
Hey,
Hi, Dr. Johnson.
how are you all?
We're good.
Good.
It's so good to see your faces.
Yours too.
Y'all didn't give me the you didn't give me the outfit memo. I would have put on yellow or black. I mean,
We didn't know we were doing this. It just kind of happened that way.
I mean, yellow is my favorite color. I could have made it happen.
Well, you have yellow in your neck.
You look so cute anyway. So Shay, you want to go ahead and...
Yes, so this is Dr. Lakeisha Johnson. She was our professor of contemporary issues in communication sciences and disorders our first year of our graduate program. And since then, she has left us for, is it Florida State that you're at?
No, she's in.
It's almost two places, yeah. So I'm currently at the University of the District of Columbia, but we just relocated to Tallahassee, back in Florida, while I'll be starting at Florida State in August.
Oh, exciting.
We're so lucky to have you, Dr. Johnson.
I know, you are
thank
such a gem.
Thank you, thank
So
you.
Victoria,
and I love the sign. I love the sign behind you. Lately. My 8%ers.
Victoria, we didn't get a chance to introduce the topic, so if you want to read what we're going to kind of ask Dr. Johnson about.
Oh, my bad, guys. Okay, so we will be talking about diversity and race within the professional setting. So even though the vast majority of SLPs are white, we obviously serve very diverse caseloads, and there's definitely a disconnect. In our poll that we did on Instagram, we asked SLPs what the demographics of the populations that they serve are, and 100% of the people who responded said that their caseloads are very diverse. But when we ask about the demographics of their workplaces, their responses are not so diverse. I do not have those numbers, guys. Where is that? Okay.
That's okay.
So we wanted to address the many questions that we got about how to most appropriately work with these diverse caseloads when the people serving them don't reflect that same diversity. So before we begin, we started off our conversation talking about our graduate experience and how privileged we were to have such a diverse faculty and diverse cohort. So could you speak to how your graduate experience was and whether it was?
Sure. My experience, you may remember, was very similar to yours. I was in a cohort with 5 African American young ladies at the same time, and I think we may have had maybe one who is Asian, maybe 2 Latinx. So we had a very, very diverse cohort when I was in my master's program. But I will say the years before that and the years after that were not the same. So it was almost like they got us all in at once.
Yeah.
So we were very fortunate. I mean, I always tell the story. I found my roommates in grad school because of like the, you know how they post the little discussion boards with like people searching for roommates. And literally, I got connected to Tamara and Carlene because, hello, Lakeisha. So they reached out to me like, hey, we're looking for a 3rd roommate for our townhouse. And that's essentially how it happened. But yeah, we had a lot of diverse in our program. And at that point, we also had 2 African-American faculty members who did a lot of work with African-American students, with students from culturally and linguistically diverse backgrounds, who taught courses on multiculturalism. So we had a very different experience, I think, than what some other students may have when you don't, 1, have a varied cohort, and 2, a varied faculty.
Right. Definitely. Okay, so our first question from the Instagrammers comes from an SLP who says, how can she best serve her diverse caseload as a white SLP?
Well, I mean, I think that there are lots of things that you can do. I actually have an article that's going to be coming out in IDA, International Dyslexia Association's journal really soon on this very topic, like how are we supposed to be serving our children of color, especially those who have language-based reading difficulties. And so the first thing I would say to that SLP is you want to utilize culturally responsive practices, right? So everything from ensuring that you have learned as much as you can and educated yourself in terms of CLD populations, in terms of different dialects, what that looks like, whether it's bilingual, if it's bilingual speakers, what are the things that you've done to increase your cultural competency? So that's number 1. And ASHA has a wealth of resources, and of course, Google. There are lots of things that we could be doing because we know a lot of times we don't get that in our coursework. I'm very fortunate right now. I'm currently teaching a sociolinguistics class with my students at UDC. So we are literally going through and talking about society and culture and how it impacts language. I know y'all didn't have a class like that.
That sounds amazing.
But of course, in the context of the current climate, it's a heavy class because we're talking about culture and power and systemic racism and how all of this gets us to where we are when it comes to language and how we interact with our clients, right? Because we have to be aware. We always start off with like awareness. We all have implicit biases. So even as an SLP who is white, you have to go and kind of search to figure out what are your implicit biases. So figuring out those, ASHA has materials on their website through the Office of Multicultural, I think it's just Office of Multiculturalism or Multicultural Affairs. On ASHA's website, they have lots of information. I think it's at Brown University. They have a culturally responsive teaching website that specifically talks about just those practices in terms of how are you making sure that you're doing student-centered things, so allowing students to have some autonomy, right, when you have things, because we as SLPs, we can embed our goals in any and everything, right? We don't have to just do click, clack, move, and Dr. Seuss. We don't have to do that, right? There are 50 million other things that we could be doing that show that we value the culture and backgrounds of the students that we're working with. So one, I'd say use some culturally responsive teaching practices where you're kind of being the facilitator, you're allowing students to make some decisions and have some autonomy. So if you're choosing books that you're going to be read, let them choose the genre, let them choose the genres, let them go through those things. If they have to do, if you're pushing in and they're doing something related to some research project, how are you helping to ensure that they have some autonomy within that? Making sure you also have high expectations for your students. We know very often that some of the biases that go towards students of color are impacted by biases that teachers may have. So if they're coming with lots of at-risk factors, then maybe the teacher may feel like maybe they're not going to be able to handle this amount of work. Therefore, I'm not going to give them as much. I'm not going to push them as hard, which in turn just continues the cycle, right? So you want to make sure you address all of that kind of stuff. Of course, the basics, don't make assumptions based on race, gender, ethnicity, disability type, all of that good stuff. And I think we're going to talk about this a little bit later, so I won't give too many recommendations here, but in terms of assessment and intervention, what are the things that you're doing to ensure that your space as an SLP is welcoming to all cultures? So if you're working with students who look very different from you, ensuring that your classroom reflects that, right? With the materials that you use. So I think that'd probably be the advice that I would give.
Perfect, very insightful. And I know you talked a lot about autonomy, but what do you think the SLP's role in teaching Black history and social justice is, and how should a white SLP approach Black history with their students?
Well, one, I think that we can't only teach Black history or think that's the only time to bring in anything Black during February. That's number one, right? If we're going to talk about and have our students feel that their cultures are valued, that their dialects are valued, we have to make sure we're telling the whole Black experience and not just pain and slavery and all of those things. We have to tell the full experience. We have to also talk about all of our joys, all of the positive things that we've contributed to American society, right? That all of the things that we've contributed. I'll stop there. So we have to also make sure we talk about that. We have to ensure that we are finding materials that reflect students just doing regular things, right? Like books, materials that feature Black kids being kids. It doesn't necessarily have to reflect some of those things with our pain and our struggles. So I'll say that SLPs, we love a theme, right? SLPs love themes, especially if you're child-based, you're school-based. SLPs, you love a theme. So ensuring that there's balance. I do think that there is a place. I know when I practiced as an SLP, I was in a Title I school, and there's no separating racism and all of these things, these stereotypes when your child walks into that door. You can't say just because it's a speech, we can't talk about that. If they come to you as a good human, right, we should be able to foster conversations that are respectful, yet allow the child to learn. I mean, who best to teach about some of these things because of our intrinsic knowledge about language, right? So being able to communicate in a way that's appropriate for the child's age, I think it's important. So I do think that SLPs can play a role in doing this, and the best way probably is through books, right? It's through stories that allow you to broach some of those more sensitive subjects in a way that's appropriate for their age. And you can still embed their goals as you need to in those conversations.
Nice. Okay. And you talked about assessment materials. So how can we make evaluations more culturally sensitive?
Wow, that's a good question. There's a lot that you can do, right? You all remember all of the things about language samples. Did y'all have me for school age language disorders too? No?
No.
Okay.
You left us.
I have to try to remember, like, were y'all like my maternity leave class or right when I left? So that was, okay, that's what it was. But so language samples are extremely important, right? We know the importance of, well, one, we know that a lot of standardized measures can be really biased towards students of color, right? And so we have to ensure that, one, we know we need to have that information, depending on if it's a school setting or a setting where you need that number, right? But you need to know how to interpret that number, how to be able to adjust scoring if necessary when you're making your report, saying that this test isn't necessarily normed on children of, a large number of children of color. So we have to take these scores with a grain of salt. But what I've also done is this. I've done some informal measures. I've done things like language samples where you can really get a good idea of what a child's performance are. when we think about African American children and the history in terms of like culture, we know that storytelling is really big, right? But we also, so a lot of times we don't leverage the strengths that children of color bring into the assessment arena, right? So we should be able to leverage something that from our culture is a strength, oral storytelling, to be able to then get a good idea of what their language skills look like, or even their artistic skills. You can use it for any of that. So utilizing language sampling would be one. I think the second thing would be dynamic assessment. So that whole test, teach, retest kind of a system, to where you're going to get some baseline information, and now I'm going to test the or teach the information or the skill or the strategy, because that's a really good indicator, right? We know that dynamic assessment has been proven to be effective with COD populations. So dynamic assessment is one, and then let's see. I think some other things that we could probably do is process-based assessments. So we know we talk about things like working memory, some of those processing tasks that aren't as based on language or linguistic output. So if you're doing the self, clearly, even though it is even though like the sentence recall kind of a thing, even if it's a task, there is some language that goes behind it, because they have to know the vocabulary, they have to have the background knowledge, right? So if you do some of those processing based measures that do not have such a heavy linguistic kind of component, to where you remove some of that, so things like working memory tasks, that's why like those nonsense word reading tasks are so important when you're trying to assess reading. So doing some of those can also, I think those would be the three things that could be helpful in terms of assessment.
Nice. Okay. Last question, and you kind of touched on this already. So how can we make sure our therapy materials are culturally and racially diverse? So do you have anything to add in that regard?
I would say being intentional, right? Go ahead. What did you say, Vanessa?
Maya's Book Nook.
Maya's Book Nook, yes. Yes, you want to be intentional, right? When we know that I'm on this whole thing, I've been talking with a lot of people about this very topic, especially over the last 2 weeks or so. It's been crazy how many conversations I've had about diverse children's books over the last like 2 weeks. But I think it's important because we have to ensure that our bookshelves that we're using are reflective of the children sitting in the seats, right? And so we want to ensure that we're intentional about finding things that are not only culturally relevant, but also authentic texts that help to tell the stories in a way that children can relate to. We know there's research that talks about engagement. When children are able to see themselves in what they read, sometimes that can increase motivation and engagement, which then increases their performance, right? So of course that's not the end all be all, but it helps, and anything that's added value is good. So when you have two books that you can still use to target WH questions, right? Why not choose the book that features diverse characters? And when I say diverse, I want to make sure we also say not just Black, right? Not just children. We want to talk about all ethnicities, all cultures, different religions, differently abled students, because we also want to ensure that we're building up students to have empathy for other kids that are going to be in the classrooms with them, right? Go ahead, Vanessa.
I was thinking, I feel like that also would just help and carry over a generalization too, because we were having this conversation. I said, if you're targeting WH questions and the book is not diverse, it's maybe all white kids or something like that, they may be thinking in their mind as an elementary schooler, like, I just need to answer WH questions this way when I see this type of person. But if it's a diverse book, it's going to say, like, I need to carry this over to home because this is what home looks like to me. So it's going to, your goals are actually going to, hopefully, maybe, I'm not saying it's a all case fits all, but it's going to just generalize into their world better as well.
Right. It's a more authentic experience, right? And it leads for more authentic conversations. So if it's something when we're going to go beyond just the WH questions with that goal now. Now we're going to also be making predictions. We're going to talk about background knowledge. Have you ever been in? You're going to distance it where you can make connections that are beyond what's on the actual pages because the child can relate to the story. So all of those things are really, really important. I also really like, ensuring that the toys that we use are reflective, right? So for those of you who are working with young children, you want your toys to be reflective. If you're using things that are like puzzles for any reason, like if puzzles are a motivator, one of our favorite companies is Puzzle Huddle. They make puzzles that feature kids of color, and they come in different sizes from like 12 pieces to like 100 pieces. And so it's a really, really amazing company and one of our favorites. But you want to diversify on all aspects, not just with your books, but with all of your materials. If you have a child who is a Spanish speaker, or a child that is from an indigenous tribe, you want to ensure that you're bringing things in that reflect that child's experience. So then it allows them to feel more connected to you. It helps you establish rapport. All of the things that we know good clinicians do, it allows you to do that in a much easier way.
One other thing I was thinking about was if you're using picture cards or something like that, you don't have to just, if you notice that your cards are portraying one type of person, you do not have to stick to that box picture card set. You can go, and there's so many softwares now where you can make your own cards. You can tailor your therapy to your kids, because I feel like that's our responsibility for our clients. Like,
absolutely. When you're making that social story, when you're making that social story, when you're using Board Maker, even if you can't find anything else, find a magazine, find an Essence magazine, something where you can find kids or situations that reflect the kids that you're with. So that's a really good point. That's a really good point.
And I also don't think that's only when you're working with diverse caseloads. It's exposing all of your kids to this, because you don't want anybody's world to just look like them.
Exactly.
So I think that's also important.
I always talk about how when I post things for Maya's Book Nook, it's not just for Black parents, right? It's for everybody, because the same way I'm introducing her to, the same way I'm helping her to appreciate and love who she is and the skin that she's in, I'm also introducing her to all of these other cultures. So if she were to come in right now and see you, Hanifa, she's going to be like, she looks just like Mommy's Kamar. She's going to say, she's going to remember from the book that we read, she's going to say, oh, I know exactly what that is, right? She's going to have those connections because we've exposed her to things. The same way that if you read The Snowy Day to a child in Florida who's never seen snow, the one time it finally happens in a decade, they're going to have some recognition and some background knowledge because you expose them through something. So it's really, really important that we don't just say we're doing this for our children of color, but for all children, because it's important. And especially in these times, as more people start to understand the importance of moving past, just kind of being colorblind, but to valuing color. And, I see who you are and I want to know more.
Right. That definitely makes a lot of sense. So those are all of the questions we had prepared for you, Dr. Johnson. Does anyone else have a question to ask, or do you have any information you'd like people to know? Vanessa?
Yeah, I just wanted to ask Dr. Johnson to plug her daughter here. We obviously want to provide resources to people teaching, and this is a very valuable resource that you all can use. So I'll just have her speak on it briefly before we say goodbye.
Sure. So I do run a website, Maya's Book Nook. The whole premise behind it is to promote language and literacy skills through diverse children's books. So it's not just for children with disabilities, it's for all ability types, because books we know are so important to making those connections. And you can embed so many different language skills from all ages. So the website, the social media, everything is Maya's Book Nook, MAYA, just like Maya Angelou, one of our faves. So you can definitely check that out. I am currently working on putting together a teachable course on like an online course specifically on how SLPs can utilize diverse children's books in their therapy sessions. because I'm being inundated right now. As you know, we're in very challenging times, but so many people are being awakened, which is really, really good. But I also want to ensure that as they have the materials that they need to be successful, and it's not just going to be me with more free labor of doing,
exactly.
Like, I'm not going to respond to every DM asking me for what book should you use in therapy. No. So what I'm planning to do and work on over the next week or two is put together an online course that people can take at their leisure to figure out, especially over the summer for school-based SLPs, while you have a little bit of time. There are lots of resources that you can use. First Book is one of them. That's a website, firstbook.org, where if you work in a Title I school or at a Head Start, or if 70% or more of the children at your school are on free and reduced lunch, you can buy books at a reduced rate. So the price is much cheaper. And then Scholastic also has a literacy partnership very similarly, where your school can sign up as a literacy partner to be able to access and purchase books at a much lower rate. I think the last thing I'll add to that, Vanessa, is that as SLPs are diversifying their bookshelves, be sure to support Black-owned bookstores as you're doing this. Don't just go for the convenience of Amazon. You know, we want to support, there's a nice hashtag, Own Voices, OWN Voices on Instagram that I love, because it is specifically about books by people of color about children of color, right? So because we know what the stats are in terms of the number of books that are written by people of color, as well as the ones that feature diverse characters.
Right.
They're pretty abysmal, right? Yeah, we're making some increases, but still to this day, I think I pulled it up just so I can make sure I had my numbers right. I didn't pull it up. I think it's 50% in terms of 50% of children's books from 2018. There's this Children's Cooperative Book Center out of the University of Wisconsin at Madison. They collect all of the children's books that are produced, and they look at them, comb through to talk about the authors, whether books are diverse. And so in 2018, there were only 10% of books that featured African American characters, while 50% featured white characters, and 27% featured animals or some creature, like a robot, a unicorn. When you think about other persons or groups of color, Latinx only 5%, Asian Pacific Islander only 7%, American Indian or Indigenous 1%. So even all of the persons of color still don't equal the 27% that's animals. We got to do better, right? And then it's even fewer when we think about the number of these books that are written by people of color. So only 6% of the books in 2018 were written by African American authors out of all of the books that were published. So it's important that we support the authors that are working so hard to ensure that we have books that have varied voices.
Right. Well,
Ooh,
thank you so much, Dr. Johnson.
Yes,
I miss you all. I'm so glad.
You
Yeah, thank you so much for inviting me. It's been good to see all of your faces. We definitely have to do this more. Tell me about your Instagram, because I don't know about it and I need to be following.
Well, we have not yet made a dedicated Instagram, but this is definitely something we want to make a series of this. We don't want this to be a one-time discussion. Right. So we will definitely be establishing something a little bit more permanent, and then we'll let you know.
Okay, perfect.
Thank you.
All right, thank you.
All right.
Okay.
Oh, she's great.
Okay, so we have like 4 minutes before Katie comes on.
Yeah.
So I wanted
to just, quickly introduce Katie. So Katie is one of our classmates from our cohort. She's one of my best friends. She's actually, she's a white student, or now SLP, and she's always been just such a great ally and such a great, she's been so eager to learn at every stage of me knowing her and all of us knowing her. And I think that she's a great resource for us to kind of understand. We are speaking not on behalf of all Black people, but we're speaking from our experience. And so we thought it'd be really great to have somebody speak from maybe a white person's experience, although she's also not speaking for all white people in the field. So she's going to come on and just answer a few questions in a couple of minutes. But I don't know if there's anything that you guys kind of wanted to unpack from what Dr. Johnson said. I thought she shared a lot of great wisdom.
She did.
Said about just making sure, so like as SLPs, especially in the school setting, your caseload just may overwhelm you so much that to take the time to go to Boardmaker, to make extra it's so easy to just say, I just need to go back in my cabinet and use this today because I don't have time, I can't. But you really, like once you put in that, maybe take one Saturday out of your month to dedicate, one Saturday out of every month to just dedicate to making sure your materials or your themes are diversified, just taking that time to really ensure that you have the materials set up. And that way it'll get easier and easier each month. If you have a report that already has that statement in there of this assessment may not reflect this student correctly, if you have that statement ready to go, it'll be there for you to use if you ever need it. So it's not like extra work every time you have to do it. I think dedicating time to it is very important, but I also understand like there's so many things going on as a school-based SLP or even any SLP if you're working multiple jobs. But I just think it's very important to put in the time and put in the work, and that is exactly why we're having a discussion, because that's the time that has to be put in.
One thing that I was thinking about is like, and I know we discussed this, is Teachers Pay Teachers is such a great resource for SLPs, but again, a lot of the materials on there only feature a certain type of character or child or whatever. So Black SLPs, like I feel like we need to step up, or SLPs of any diverse background need to step up and start creating, because you put it out there and I guarantee there's an audience for it. I guarantee people are hoping that something comes along that is easily downloadable, that they don't need to go cut and paste themselves, you know? So I think that's something we definitely need to think about. We were talking about having social stories for maybe Black kids to deal with police, because that's such a subject right now that really needs to be talked about. So, you know, we definitely need to do better as well.
And then if you take the time to make these resources, once you have it forever. And then if you save it digitally, you can share it. So the burden is not like all on one SLP. Share it with another SLP in your building or your friends, your professional network, and that can go a long way, and we can all kind of chip away at it. So it doesn't feel burdensome. But like Vanessa was saying, just take a day and then the reward will be so worth it.
Right. And I think it's important to understand that being a speech language pathologist is a larger responsibility than just a job that pays your bill, right? Like we are laying the foundation for, whether if you're in the school setting, you're laying the foundation for these children to go out and be adults who reflect the values that you would want your own kids to reflect, right? Like for a lot of these kids, we are their outlet. We are the mediums by which they find freedom to express themselves, freedom to feel, you know, any way that they feel, and just be themselves, you know. So I think that it's important to be mindful of the responsibility that you've taken on in being a speech language pathologist.
Right. Yeah. And Katie is here, so I will admit her to the conversation. Hi. Hey.
How are you guys?
Good. How are you?
Good. I'm so happy to be here. You guys look amazing.
You too. We're happy to have you.
Wait, I love that shirt.
Got it on sale at Target.
Vanessa and I missed the yellow memo, guys. We should have had yellow.
Everybody's been saying that. They're like, why didn't you give us the memo? I'm like, oh, we probably should have. So Katie, the first thing we wanted you to do is, I already kind of introduced you, but if you want to kind of talk about your work and what you've been doing this past year since we've been out of grad school quickly, and then we're going to get to our questions.
That sounds perfect. So yeah, I'm Katie, and I, this past year, have been working with preschoolers in the school setting. So in Marietta, Georgia, I don't know if people that are gonna watch this are only from Georgia. But I've loved it. It's been awesome, and yeah, that's kind of a little bit about the clientele I serve. So they are younger. I think provides a lot of awesome opportunity for conversation because younger kids don't hold back anything.
Right.
Really developed a filter or anything like that. Most kids are 3 to 5, but I would really say 3 and 4 are the primary ages I work with.
Great.
And
So some of the, go ahead, V.
Before we start the questions, I just want people to remember that this roundtable discussion is coming from within one cohort. Like
Right.
Katie is someone who was in a cohort with us during our whole learning experience. Dr. Johnson, Ms. Miles, we were all in it together. So we're coming from the inside out. We're not speaking from different schooling perspectives. We were all together. I think that's very important to just restate.
Yeah, definitely.
Well, and I think one thing with that that's really cool though is like being in the same cohort, we all grew together professionally, like as SLPs and as we entered the field, but also personally because we spent so much time together.
Right. And it's also interesting that even within the same program, we can all still have such different perspectives and such different amounts of wisdom to share. And that's why we're doing this, you know? Yeah.
And
so,
in all our like first year post grad, we all had totally different like work experiences. So we can kind of speak to a little bit of that as well.
So the first question we got all these questions from Instagram, Katie. And so the first one that somebody asked was, how do you think that you could be an ally within the field and encourage your peers to do the same? As we know, speech pathology is a profession that is mostly white women. So how can you work to be an ally and encourage others to follow your lead, basically?
I think that's great. I think a lot of ways, but the main thing that comes to my mind is education. And I think it's so important that I, as a white woman in the field of speech pathology, educate myself, because I think a lot of times, like, I mean, all of you have helped with my education and you've answered awesome questions for me, but it's also not your job to educate me. And I think while that can be a great resource to use your friends, and I think you should and have those conversations, I think educating myself, becoming aware of all of the things that I'm sure you guys have been talking about and that we are talking about is huge, but also I think encouraging my other white SLPs to educate themselves. I think it actually goes farther than just encouraging them. I think it's holding them accountable and holding myself accountable, because I think, you know, it's easy to say like, I want to educate myself, and Sally, who I work with, like, I want you to educate yourself and I want to be better, but also to hold each other accountable to actually do the work and maybe even push through like feeling a little uncomfortable while doing that work, because a lot of what I've been learning has been a little uncomfortable, but sitting in that and working through that and using it to grieve and attempt to go towards like empathy with my brothers and sisters and pushing through and continuing that education even when it's uncomfortable.
And I think it's that willingness to be uncomfortable that makes that is the only way you can come to some sort of change. Like if you stay in your comfort zone, I know I've put myself out of my comfort zone a lot, at least especially these past 2 weeks, and that's the only way you can start something valuable. Like I feel like if everybody's just comfortable staying silent or just like, you know, just having that one Black friend or whatever it is, then you're never gonna grow past that, and you're not gonna be able to serve your students or your clients as best as you can. You know what I mean? So.
Yeah.
And I also wanted to say, like, it's important that, like how Katie said, holding herself accountable. I struggle with this sometimes. Like Katie said, we are a great resource, and I just want to really say when our white classmates or our white colleagues come to us maybe every so often as a resource, to just be approachable and just have a soft heart with that, because I know that can be hard on our end, because we're like, it's not my responsibility. Listen, I'm not going to teach you what you need to know about what happened. Like, it's so easy to get in that mindset, but that's also part of being uncomfortable sometimes. I really truly appreciate when someone comes and asks me a question. I'm not the spokesperson. Once again, I understand that. However, if you have a question, I want to honor what it took for you to maybe come ask me that, and I want to respect that and answer whatever question you have.
Yes, because that also reflects on the fact that, you know, they're not looking within themselves to come up with an answer, right? They're not relying on their assumptions or the stereotypes that society has set for certain populations of people. They are taking themselves out of their comfort zone in order to actively gain education or perspective.
And I always say, yeah, go ahead with it.
That's big.
I always say that, like, I have like two sets of, you know, things that might make people feel like they have to ask me, or they want to ask me questions. I'm Black and I'm also Muslim, visibly Muslim. And I feel like I've never had the kind of mindset that don't ask me questions, go Google it. Like, I've never done that, because I feel like I have a responsibility to inform people, not inform people about things that they should already know, like, you know, like Black Lives Matter. People should know that. People should know that already. But things like, why do you do this? Why do you do that? Or something like that. I feel like, why not just answer, and they can have your perspective from somebody that they actually love and they have a vested interest in your well-being. I feel like I'm so open to that, and I've always been. So,
and, sorry. And beyond that, I know that we talked about we have to be approachable because, you know, they're trying to get information from us, but I think we also have to look at it. It's like, we have a responsibility to the client. If this is another SLP asking you questions about cultural competence,
right,
or is this typical of your culture or something like that, if we respond to that incorrectly or callously, that's not best serving the client. And that SLP needs that knowledge, and then they won't have the same questions further along in their practice, and then they can pass that information along to another SLP. So if we shut that down and just are unapproachable and don't want to answer, it's like the information and the knowledge stops there. And in our profession, since we're a helping profession, we really don't have the, I don't want to say privilege, but we don't have the luxury of doing that. Like, we have to take that on for the sake of the client and for the sake of our students.
So our second question, a lot of people ask, what can they do to help support their clients who are people of color? So I wanted to know, Katie, as an SLP, what do you think you're doing, or what do you think you could do in the future to help support your little kids who are people of color?
Yeah. So one thing, I think what comes to mind are two different things. And the first one thing, as I've been reading and kind of educating myself, is I've realized this, and I'm kind of embarrassed to say that I didn't realize this was something that happened in our world, but this big gap between what white people receive in the medical fields and what Black people receive from medical professionals in the medical field. And that, I mean, that's horrible to me. Like, just some of the facts I was reading, and these were just broad facts. It's unreal how the care isn't equal. And I think, to me, it sounds, well, of course you should give equal care to all your clients, but it's not happening. And I think if more white SLPs are becoming aware of that and having that discussion, just being able to provide equal care to all of our clients, whether they walk in and they're Black, whether they walk in the room and they're white, providing the same care. And specifically with my job as an SLP, because I do work with such young children, I work with the parents almost as much as I work with the kids. And I know that's not the case for all SLPs, depending on what age group you work with, but it's also very important for me to provide the same amount of care and education for my Black moms and dads that come in as my white moms and dads. So just providing that equal care to all of the clients, regardless of their skin color or their disorder. I think that's one really huge way. And another is really celebrating the differences. Like I said earlier, I work with preschoolers and they say everything. They don't care. And if I have a group And there might be a little black boy and a little white girl. If the white girl says something about the little boy's skin color and ignores that, instead of claiming up and being like, let me change the topic, like, know how to address this, but really, like, diving in with that. And I'm not their parent, so I do have to, I can't go into a education, but being able to like celebrate that and acknowledge, like, that's what we're seeing. Like, yes, he does have a different color skin than you, but he is loved and he's valuable and he has characteristics that you don't have. And just being able to kind of acknowledge that. And then, the next 5 seconds, they're going to move on and be talking more.
Right. The other kids aren't even paying attention at that point.
Yeah, but I think like that's something that's so important to not skim over in, because just because this is a professional setting and this is our job, it doesn't mean that those real life conversations aren't going to happen in our therapy rooms.
Right. And I think if we avoid it, sorry, Whit.
Sorry, go ahead, Han.
If we avoid it as like an awkward subject, like, oh, let's not talk about that, then I feel like both of those kids are at a loss, because the little black boy will think, okay, my skin is something that we shouldn't talk about. And then the little white girl will be like, oh, we need to not see color. We need to just ignore it. And so for you to step up and be like, yes, let's talk about it. It's great. And here's why. I just feel like that little thing is such a world of difference. And that's not what I experienced when I was younger and going to school. We could not, you don't talk about stuff like that because it's awkward or it's taboo, and it shouldn't be. It should be like talking about anything else we talk about in speech,
As uncomfortable as that situation may make you feel, you should take it as a valuable opportunity to shape those kids' perspectives for the future.
Right.
Because I know I would feel extremely uncomfortable in that situation. And I'm going to be honest, there have been times when it's been like, how do I address this awkwardness having to do with some type of identity difference, whether it's race or sexual orientation. And, I have shied away from those opportunities to shape those perspectives. And I regret that. So I think that's a good point, facing it.
Yeah. And I found like in those moments where I think this is awkward, if you just like address it and you say something, it's actually not. And
right.
Especially for kids, they don't care.
Yeah.
So we were talking about a lot at the beginning of this conversation about diversity at the university level. And Katie, although like our cohort was pretty diverse, nowhere's perfect, and that's actually an anomaly amongst master's programs. Most master's programs are not diverse, especially in this field. So sometimes we did encounter things that made us uncomfortable, or things that we were just like, we had to talk about it later in the car because we were just like, oh, how do we handle those kind of things? Like, you know what I mean? So how do you think that kids in grad school can kind of address their white classmates if they notice something problematic? How do you think you can start those conversations when you don't want to be the one who's like super sensitive, or you know what I mean?
Yeah, I think that's very important. And I think my first reaction of that is if a white person in your cohort, a classmate, says something uncomfortable, insensitive towards a black person, I think so often what we hear as a response is the black person saying something back. But while that's important and we have to advocate for ourselves, I think it's important. I feel like might not be the right wording, but I feel like it's important for the white person to say something to the other white person. Not just say something, but be willing to take action. So if you're and a white person says something uncomfortable, insensitive, inappropriate, saying something, and then if it continues, being willing to get up and leave.
Yep. Back to accountability.
Yeah.
And I will tell you that my grad sisters and I, Hanifa, Vanessa, Kennedy, and Victoria, we have at certain points held each other accountable as well. We have gone back to each other and explained a situation that made us uncomfortable, whether it was amongst our professors or our peers. And we've been like, that wasn't really a situation that you thought it may have been. You probably checked yourself in that situation. So accountability across the board.
And we were also talking about like, it's one thing to have conversations amongst ourselves like, oh, that made me uncomfortable. like that probably shouldn't have happened. But also, if it's something that's going to address the cohort afterwards, being brave enough to go up to whoever it is, even if it's a person in power, and saying like, you know what, I respect you 100%, but here's why this is wrong, and here's why I don't want any other girls or guys after me to have to experience that. And that's something that I know I was too scared to do. But I don't want other people to be too scared to do that, because at this point, you're in a master's program, you're an adult, and you should be able to say these things in a respectful manner, but you're not at a level where I just have to shut up and just take it, you know? That's a hard lesson to learn.
I think it's important too that, like, as the white person, if you say something and somebody comes to you with like, they're bold enough and they're brave enough to come say, hey, you said this is how this situation was interpreted, that it's really important not to get defensive. And I have found sometimes, like, I haven't had a situation like that happen to me. I'll read something and I'll feel kind of like defensive, like, oh, I need to prove that, I need to prove that I'm not a racist and I lie. But really, that's not the issue. Like, the issue is to see and listen and have the conversation, because that might not have been your intention at all. But not realizing how what you're saying is coming across, or if maybe it's an area that you're really ignorant and you're saying something, like, just being able to listen and have that conversation and not have this defense go up immediately. Because so often, before everything happening right now, defense is the first thing to go up. And I hope that a lot can change from everything happening in the world, but I hope that that's like a big one, is people are able to have these conversations and not be as defensive, learn and hear the feedback and grow, and not get like petty.
And Katie, I know I know you and Katie, have had so many conversations. I mean, we've had hours of conversations about, you know, things that I don't think a lot of like friends who look so different than each other are comfortable having. I think that, and I've always found that I can say anything, I can bring up any topic to you, and I feel like you're willing to listen and learn and have a dialogue. And that's so valuable. I think that's almost why it's so valuable to have friends that don't look exactly like you. Because like, a friend is someone who you can feel comfortable enough, you can be silly and be comfortable enough to just talk about it. Like, and that's the only way. And then that friend can go and take it to their significant other or their family. And I just think that's absolutely essential. And that's why we brought you on today. I mean, you're just amazing.
Well, I'm honored to be on, and I love it.
So I think the last thing we just want to say is, do you have any questions that you raised during this time where everything's been so crazy, like that you want clarification on, or that you're trying to explore on your own time? Do you have any questions?
Yeah, I actually do have one. So as we've talked about, like, the importance of education is huge in all of this. One thing that I have really felt convicted about and just like really want to do differently going forward is the education within our home. So you guys, my husband and I don't have kids yet, but we hope to as a family. And I think the biggest place that we can shape kids is within the four walls of our home and in our home. And I think it's important, a lot of people that might end up watching this do have children, and I think people are realizing the importance of educating their children and their spouses on race and how, really on anti-racism. I think people are realizing that importance, but I think a lot of people don't know where to start. And I do think this can bleed into conversations we can have in our therapy room, but I was wondering if you guys could give maybe like some examples of where to start that conversation within your home.
Ooh, I think it starts with books. I don't know about you all. I think that books that reflect the differences not only in race, but just in any identity is important to expose your children to. Books are the foundation for language, I would say, and that you know, harvesting that language and those speech skills as your children grow up. And I think that's the best way that they can connect with the differences that they will see in the world as they grow up. So just providing them with those resources, making them an everyday tool that your children can go to within the home, and look at. I think.
And
Vanessa, did you have something? Yeah.
I was going to say the same as Whit, just off of what Dr. Washington said. You don't have to just use diverse books within your therapy room. You can use them within your home. Mm-hmm. And so, like, reading books to your children with diverse characters, they're going to see Black kids, a Muslim child, or whomever we're speaking of, Latina, in a light of like, oh, they're just like me. Oh, you know, or that could be my friend too. Or if I see someone, I know what the word hijab means. You know, I know what that is. I'm exposed to it. It's just simply about exposure. I mean, this thought is coming to my head, and I don't know how crazy it's gonna sound, but I'm just gonna say it. Like, even if you just go to a grocery store that's not in your community, like go to a grocery store that you know is going to be predominantly Black, and be in there and shop in there and just let them see in real life too, not just in a book, but take it into real life. You know, like go to an Indian grocery store, go to an Ethiopian restaurant, like just go to places to expose them, to say like, this is just the world. You know what I'm saying? Like if you see a field of different colored flowers, you're not going to judge it for its differences. You're going to say, wow, that's beautiful. You know what I'm saying? You're just a field of beautiful flowers, not to compare us to flowers, but you know what I'm saying? Like, it's beautiful, and what can we do about it? How can we change it? We're all going to come out different colors. We're all going to come out different ethnicities. We're all going to come out different races. So just come on now.
And that's not to say that you should promote the idea of not seeing color, because I think it's important in your ability to see your privilege, which is the way it is, right? But again, that exposure, those experiences are so important.
And another thing is, I am all for protecting the childhood of our kids. Like, we do not need to, in my opinion, I don't think you need to show like every, horrible thing that happens to a Black man in America does not need to be shown to your child, to your young child. But if your child has questions, I don't think there's anything wrong with being honest and educating your child. If your child comes home and says, somebody made fun of so-and-so because he looked like this, I don't think the thing to say is, well, let's not talk about that. Let's talk about it, and let's use child appropriate language. But let's talk about it, because we also don't want, a lot of things I've been hearing from my white friends this week is, I grew up with people that I only saw people who looked exactly like me. And we never talked about race in my house. It was like a taboo topic. But why? Why not change that, at least for our generation coming up? Because I do not want my child to be naive to what's happening in the world. You know what I mean? So.
Because we've seen the opposite. We've seen not talking about it doesn't work. That's clearly not a solution.
Right.
So I think everyone had really excellent points about the books and the exposure.
And their TV shows, their cartoons.
And movies,
Art.
Right. Art,
No, I think that's really good stuff.
Yeah. Well, thank you so much, Katie. That's all the questions we had for you. Thanks for coming.
Thank you for having me. I'm so thankful our cohort brought us all together to be able to help.
Katie.
Hey, we love you.
Bye. Love you guys.
All right.
Okay.
So after talking about all of those heavy topics, I think it's important for us to finish off with highlights about the positive parts of being Black.
Earring the spot store earring.
Oh my gosh.
Those $3.99 pack of earrings.
Just fall off. Okay.
Yeah, we want to make sure you guys know, and I'm sure you do, but make sure you know that loving being Black, or being Black in America or anywhere, it's not a struggle all the time. It's not hard. It's not something we wish didn't happen to us. We want you guys to know that there is beautiful, joyful things about being Black, and that's something you can share with your clients. Share with them positive pieces of Black culture, and that way they don't think we are just a group of oppressed people. Because we obviously we're full people. We lead full lives, and we want people to see that as well.
We're passionate, we're creative, we're talented, and that really reflects in, you know, movies, the TV shows that we create, the books that we write, the documentaries that we make, the art and the music that we make. All of those beautiful things about being Black really reflect in the things that we produce.
Right. So we did make a list.
What, of books?
We made a list of some, let me see, what do we have here?
The media list?
We have a media list or a Black culture, pop culture list. We have movies, TV shows, books, documentaries, influencers on Instagram, like diversify your feed.
Right. If you didn't see any squares on your feed on Tuesday, you need to follow some new people, okay?
Yeah.
Some of my favorite movies include, and I'm reading off the list that we kind of all compiled, but Moonlight, wow, that was
one of my favorite movies.
By a Black director, might I add. Remember the Titans, Waves, Just Mercy, If Beale Street Could Talk.
Oh, it's so beautiful.
That was sad, guys.
Yeah.
Never seen it.
You never, it's really beautiful. It's a good movie.
Good. It's
and
go ahead. Actually,
I think it's based on a book by James Baldwin, who I also love. Some TV shows that we all bond on watching Insecure. That's a fun TV show. Watch that. Dear White People, I love. When They See Us is really heavy, but I think it's like it should be required watching as well. So yeah, we're gonna put that kind of list.
I also want to add another movie. I'm not a movie watcher at all, so. But I feel like if you have ever seen Higher Learning with Ice Cube,
I've never seen that.
Hey, but Higher Learning is such a great movie. It has Ice Cube, Tyra Banks. It's a really good movie, but it's an old school movie. It's about students in college, and they're dealing with the different racial issues going on at the time. Great movie, Higher Learning. I'm
gonna watch that. So is there anything else we wanted to talk about before we sign off? We don't want to make it too long. Oh, I think we wanted to talk about what our plan is like going forward.
Oh yeah, future episodes.
So we definitely plan on having more episodes in the future. This was our first time, so thank you for bearing with us. It wasn't perfect, but we will polish our skills, trust me. This is just the beginning of something that we know we're going to grow. We don't believe we're going to grow it. We know we're going to grow it. And I think it's important we address this topic, but we obviously realize we come from a very, compared to other grad programs, a very fortunate situation to have so many of us who are Black and diverse that in our field, that we're in a cohort together, and also to have diverse staff who rooted for us. That is also very rare compared to other programs. So next month, we are hoping to have a episode from a student who was in a master's program, a speech pathology master's program, that was not very diverse. One or two students of color in a non-diverse university as well, and in a non-diverse state. So not just one, not just two, but three components of lack of diversity that all impacted her learning, her mental health, and things like that. So next month we hope to have that. And then we also want to bring on a white SLP in the field who's in a predominantly Black school. I think that would be an amazing episode too. But we're still in the stages of building each episode, but we want you to know what's coming is going to be great. Okay, so before we sign off, I think it's really important for us to acknowledge all the other Black staff who were not able to join us, but hopefully will join us in the future, and also our other Black cohort members that were with us during our time. So I'll start with the staff. These are all the diverse members of our staff that we want to honor and appreciate. Number one, Dr. Julie Washington. We love you, we respect you, we thank you. Dr. Stacy Wallen, Dr. Cynthia Peranic, Teresa Graham, Darius Evans, LaKendra Fort, and Dr. Eileen Chu. We love and appreciate you. Thank you so much. And all our other Black cohort members who were not here today but will be in the future, we want to say shout out to Kennedy Hobson, Melissa Smith, Kayla Wims, Ashley Azza, and Alicia Pollock. We really hope we are representing our cohort well today and through the questionnaire, and we have you in our hearts while we did this. So thank you so much, and we love you all, and thank you all.
Thank you all for joining us.
Yes. Thank you so much.